I'm Dr. Teresa Alasio, and in this video, I'm going to explain what EmFace is, how it works, who it may be appropriate for, and what patients can expect before, during, and after treatment. I use EmFace in my practice as a medical and aesthetic treatment for patients who want to improve facial tone, lift, symmetry, and skin quality without surgery, injections, or downtime. My goal in this video is to help you understand what the treatment does, how we use it clinically, and when it may be a good option. Well, let's start with what EmFace is. EmFace is a non-invasive treatment that works on two things at the same time: the facial muscles that support expression and lift, and the skin and underlying tissue that affect firmness and smoothness. So unlike neuromodulators or fillers, EmFace does not freeze the muscles and it does not add volume. Instead, it strengthens key facial muscles and improves the support structure of the skin, which can help the face look more lifted, rested, and naturally supported. In my practice, I see patients who choose EmFace because they are noticing changes such as heaviness in the midface, flattening of the cheeks, softening along the jawline, eyebrow descent, or a tired or sagging appearance that does not match how they feel inside. It is also helpful for patients who prefer a non-injectable approach or who want to maintain facial expression and natural movement while still supporting facial structure and tissue integrity as they age. So here's what happens during a typical session. The treatment is done while you are lying comfortably. Small applicators are placed on the forehead and the cheeks. So during the treatment, you'll feel your facial muscles contract in a rhythmic pattern, along with a warm sensation in the treated areas. You're awake and comfortable the entire time. There's no anesthesia, no needles, and no recovery period. Most patients return to normal activities right away. A full course of EmFace is usually a series of 4 to 6 sessions spaced about 1 week apart. Some patients notice early changes, such as improved lift or facial tone after the first couple of sessions. Most results continue to develop over the weeks following the full series as the tissues respond and adapt. Our goal with the treatment is not to change the way someone looks, but it is to support the natural structure of your face and reduce the signs of fatigue or descent and help patients look like themselves at their healthiest and most rested. So most patients tolerate EmFace very well. Possible short-term effects may include some mild redness, some warmth in the skin, temporary muscle fatigue, or a light sensation of tightness after the treatment. And these effects are usually mild and they resolve quickly. Before starting EmFace, I review each patient's medical history, prior facial procedures, skin conditions, muscle disorders, implanted devices, and individual goals, just to make sure that the treatment is safe, appropriate, and aligned with what they want to achieve. So patients often ask how EmFace is different from fillers or neuromodulators. And this is certainly a valid question because fillers actually add volume and are typically used to replace lost structure in specific areas. Neuromodulators like Botox relax muscles to soften wrinkles caused by movement. EmFace, however, does something different. It strengthens supportive facial muscles and improves skin support and firmness. So it complements, or in some cases, reduces the need for other treatments. So you may need fillers or Botox less if you have EmFace. So in my practice, EmFace is often part of a thoughtful, individualized facial rejuvenation plan that's focused on function, structure, aging patterns, and long-term tissue health. So if you're noticing facial sagging, heaviness, volume loss, fatigue in your expression, or changes that affect how you feel about your appearance, and you'd like to discuss whether EmFace may be right for you, just schedule a consultation with my office and we can sit down and talk about it and figure out if it's a good fit for you by reviewing all of your medical history and your goals and looking at your facial structure. And we can figure out if this is part of your treatment plan. And if you like this video, like and subscribe, and go to my website at intentionalselfaesthetics.com, and I look forward to seeing you in a future video. Thanks for watching.